Stories of men who felt unwell or even died after taking Viagra or Tadalafil leave many people feeling insecure. These concerns make sense, especially for those with heart problems or who take medication for blood pressure. The fear of serious risks often prevents many from seeking help for erectile dysfunction, but it's important to understand what's really behind these situations. I'm Diana Ruiz, a urologist, and in this video, I'll explain how these medications work in the body, what effects to expect, and what can happen when they're used carelessly or without medical guidance. I'll also clarify why, in some cases, they may pose a higher risk and how to avoid serious complications. If you've ever thought about using these medications or know someone who needs this information, this video will give you everything you need to make safer decisions and protect your health. Before we continue, make sure you're subscribed to the channel to keep up with more content about health and sexual education. If you find the information in this video useful, leave a like so more people can access it. Comment 1 if you like the topic or 0 if you have suggestions to improve the content. Your feedback is very important. Let's talk about something many people mention but few truly understand. Can you die from taking Viagra or Tadalafil? It almost sounds like one of those movie plots or bar stories where someone swears they know a case like that. There's no shortage of people saying someone died at a motel or at home after taking one of these pills. It's easy to see why this raises concerns, but is it really true? First of all, it's important to remember that an erection is entirely connected to the vascular system. For the penis to become erect, blood needs to flow into structures called cavernous bodies. When this happens, these structures fill with blood and expand. At the same time, the veins that drain the blood temporarily close, maintaining the necessary rigidity. For those looking to strengthen intimacy in their relationship and improve their sex life, my digital book, Rediscovering Intimacy, Healthy Sexuality After 60, offers practical advice for overcoming physical and emotional challenges, deepening emotional bonds, and reigniting desire. The link to access the book is in the first pinned comment. This could be the opportunity to renew your connection and transform your love life. Medications like Viagra and Tadalafil work exactly on this mechanism. They relax blood vessels and increase blood flow to the cavernous bodies, making it easier to achieve an erection. But how do they do this? They inhibit the enzyme phosphodiesterase type 5, which helps keep cyclic GMP levels higher. This compound, in turn, boosts nitric oxide production, the body's most powerful vasodilator. In short, they help blood flow more effectively. And because they are vasodilators, this is where caution is needed. If someone is already taking blood pressure or heart medications, combining these drugs can cause sudden drops in blood pressure. That's the point where serious complications can occur. It's not the erectile dysfunction medication itself that causes problems, but improper use or taking it without medical guidance. So before rushing to the pharmacy or letting fear take over, the safest approach is to talk to a doctor, especially if there's a history of cardiovascular problems. Medications like these can greatly improve quality of life, as long as they're used correctly and safely. Information is always the best tool for making conscious decisions and avoiding unnecessary risks. Many people have doubts and even fears about using Viagra or Tadalafil. After all, can these medications really cause death? Let's clear this up once and for all. These drugs, used to treat erectile dysfunction, do not directly affect the heart. They don't speed up the heartbeat or force the heart to work harder. What they do is relax blood vessels, improving circulation and increasing blood flow to the penis. This effect can also occur in other parts of the body, such as the face, causing temporary redness or even a mild headache. These are common effects and are usually not a cause for concern. But like any medication, they require caution. Because they are vasodilators, they can slightly lower blood pressure. For those already taking blood pressure medications or nitrates for heart problems, mixing these substances can be dangerous. Blood pressure may drop too much, and this can lead to serious complications. Studies show that when used correctly, these medications are safe for most people, including those with controlled high blood pressure. Some research even suggests they may have positive effects on circulation and vascular health. That's why, before using Viagra or Tadalafil, it's best to talk to your doctor. This way you can clear up any doubts, assess risks, and ensure safe use. Information and responsibility always go hand in hand when it comes to health. Many people have heard the classic story. A friend of a friend went to a motel, took Viagra or Tadalafil, and died. Then the question arises, could this be true? Can these medications really cause such a serious problem? Let's clarify this without panic. The first thing you need to know is that these drugs, when used correctly, do not directly cause death. They don't attack the heart or trigger a heart attack on their own. What they do is dilate blood vessels, improving circulation. This helps with erections, but it can also cause drops in blood pressure. And this is exactly where the risk lies for people who already have cardiovascular problems. If you have high blood pressure, diabetes, smoke, are overweight, or lead a sedentary lifestyle, it's essential to consult a doctor before using these medications. In some cases, the heart may already be compromised without showing symptoms. People who don't put much strain on their heart daily may have plaque buildup in their arteries without realizing it. Then, by taking a vasodilator and putting extra demand on the cardiovascular system, problems can arise. That's why it's crucial to get a checkup and understand your heart health before taking Viagra or Tadalafil. When used responsibly and with medical supervision, these medications can be safe and improve quality of life. But without guidance, the risk is real. Information and caution are always the best allies to avoid serious problems. Think about it. You decide to take Viagra or Tadalafil, feel confident, and move forward with sexual activity. What many people don't consider is that sex isn't just pleasure, it's also physical effort. It's almost like running uphill, especially for those who are out of shape or have heart problems. Imagine someone sedentary, living a calm life without demanding much from their body. That same heart, accustomed to a light routine of work and rest, might not be ready for a more intense activity like sex. And this is where the risks begin. These medications, like Viagra and Tadalafil, relax blood vessels, making it easier for blood to flow to the penis. This helps with erections but also makes the heart work harder to keep the blood flowing. If arteries are already partially blocked with fatty plaques, blood may struggle to reach the heart when it's needed most. Now consider this. The heart needs to beat faster to deliver oxygen, but compromised arteries can't supply enough. This can lead to a heart attack. And it's not because the medication directly caused the problem, but because the person already had an undiagnosed cardiovascular condition. The main point is that Viagra and Tadalafil can be safe for many people but require caution. If you already have health problems, especially related to your heart, or take blood pressure medications, consulting a doctor before using these drugs is essential. When used under guidance, they can improve quality of life. But without care, the risks increase. Let's get straight to the point. Taking Viagra or Tadalafil without medical supervision can indeed pose serious risks. These aren't medications you should take just because someone said they work or because you saw them mentioned in a video online. The issue isn't with the drug itself, but with people taking it without knowing whether their heart can handle the strain. Many people believe these medications are harmless, but the truth is that before using them, it's crucial to undergo a full medical evaluation. This includes checking heart health, blood pressure, and other factors that could indicate risks when using these vasodilators. What often happens is that people with undiagnosed heart problems end up putting themselves at risk by demanding more from their heart during sexual activity. The combination of physical exertion and the effects of the medication can cause sudden drops in blood pressure or even a heart attack. That's why medical supervision isn't optional. If you're considering using Viagra or Tadalafil, schedule a consultation. Talk to your doctor, clear up your doubts, and get any necessary tests done. Avoid impulsive decisions based on comments or random tips. Your health deserves serious care and attention. Using medications like Viagra and Tadalafil can be safe and bring positive results for your sex life, but they require caution and responsibility. As we've seen, the biggest risk isn't the medication itself but taking it without medical supervision, especially for those with heart problems or who take blood pressure medication. If you've already used these drugs or thought about trying them, how have you assessed your cardiovascular health beforehand? Share your thoughts in the comments and let us know your experiences or questions. Your input helps enrich the discussion and may even clarify concerns for others. If this video provided valuable information for you, hit the like button to help more men access this content. And if you want to keep learning about health and sexual education, check out the other videos on the channel. They offer complete guidance for those who want to take better care of their intimate health and improve their sex life after 50.